Welcome to Focus on Health, a series of educational programs highlighting current health issues sponsored by the School of Nursing at Salisbury University. I'm Dr. Mary DiBartolo, Professor of Nursing at Salisbury University and host of the program. Today we are filming from the Richard A. Henson Medical Simulation Center, doing a program that will give our viewers an introduction to medical simulation, and I welcome Catherine Neighbors.
Thank you.
You are the simulation coordinator here, and you have a master's degree, and more importantly, you are actually certified in healthcare simulation education.
I am, yes.
And that is a very rare thing, isn't it?
It is, yep. So I sat for the exam in August and passed, so I'm now a certified healthcare simulation educator, first on the Eastern Shore of Maryland, one of 28 in Maryland.
Well, congratulations.
Thank you.
That's really quite
you.
a credential. So, and I appreciate you taking the time, because this place is usually really buzzing with lots of activity.
That's right.
And I know the purpose of this program is to give our viewers an idea of what we do here at the Richard A. Henson Medical Simulation Center. So I guess let's first give a little history, when it opened. And I know you've been here, you're going on your 6th year, but it's actually been here since open since 2011.
Yep.
I attended that ribbon cutting on a cold December day. So this place has been in business for 7 years or so.
That's right, yep.
So give us an idea of some of the activities that go on here.
Okay.
What's the goal of this facility?
Sure. So this, like you said, the Simulation Center opened in December of 2011. It was opened and created to give the students of Salisbury University a place to practice. Practice different and various healthcare scenarios that they may not see in the clinical setting while they're out in the field. But it's also available to other healthcare providers in the area. So we can do education for practicing providers as well, and not only specific to nursing.
Well, I know we have lots of really interesting high-fidelity mannequins here that we're going to take a look at in a few minutes.
Absolutely.
But tell us a little bit more, how is this center different from others in the area?
So our Medical Simulation Center is a freestanding building, so it's separate from the lecture halls and the skills lab over on campus. And so that really gives the feeling of a hospital clinical setting when the students walk in the building. It is practice, it's all simulated, but it has a very real feeling. So our students are able to really engage in the scenario, immerse themselves in the scenario, and act like they would if they were in that clinical setting.
Is this one of the larger ones on the Eastern Shore area?
It is, yes. So we have a number of rooms here. We have 6 high-fidelity patient simulators, and each one has their own room, designed to look like the clinical setting. So the equipment might vary a bit. Of course, the simulators and their features vary as well, but they each have their own unique space.
Now, I know, being a professor of nursing, that our nursing students certainly use this facility. What other disciplines also use the Medical Simulation Center?
Sure. So we have other students that come here for experiences. Nursing right now is the primary user, but it is open to all students within the College of Health and Human Services. So we do have respiratory therapy that comes here regularly, applied health physiology, that's the master's program here on campus. We have math students come here. That's a unique kind of experience for those students. We have theater students that come here and participate in simulations as well. So it's really varied all around
I know
campus.
some of the theater students come in because they're actors for our standardized patient experiences,
Exactly.
and that's a whole nother matter.
That's right.
We're going to have a separate show on the standardized patients. Today we're going to focus more on the mannequin technology, correct?
That's right.
So tell us a little bit more about the simulation experience in terms of the mannequins and how that optimizes clinical learning.
Sure, yeah. So being on the Eastern Shore of Maryland, there are sometimes limited clinical experiences for our students. Here in simulation, we're able to dial up whatever they may be learning in class so that they're exposed to that before they graduate. If you think of it kind of on a broad scale, you think about things like low risk but high volume scenarios, so things that we really want them to be experts in when they graduate. And so they can come here and have that experience. It's all standardized for them. On the other side of things, more high risk, low volume things that they may not see out in the clinical setting, we can expose them to that here.
I know I'm sitting right next to a crash cart.
That's right.
And that is something, most students are very nervous about. And what are your chances of having a patient code while you're in the hospital on a particular day? So that is something you can simulate.
Right. And so they may see that in the hospital, and depending on the scenario, they may not be hands-on. They may take more of an observation role. Whereas here in the simulation center, they're hands-on, they're working with the equipment, they're working and doing direct patient care, working with their other peers to get that experience.
And all the simulators or the mannequins, they're run by a computer program.
That's right.
And you can go ahead and program that for whatever you like.
So we can kind of dial up whatever it is that they may want to see that day. So we collaborate with the faculty members. The faculty members will tell us kind of what their goals are of the scenario, what their objectives are, and then we can kind of plan that out. One unique thing about the simulators is once we do set the parameters and the students do interventions, the simulators will respond. So it is all based on a laptop. It is run through that technology, but the technology is so high that I don't even have to push something on that tablet for it to respond.
And so what kind of things can the simulators do? Obviously you can program vital signs and things like that, but some of them actually speak and can voice complaints, and there's body fluids that can be involved. So tell us more about that.
So the patients will talk to you. The students are encouraged to communicate with the patient just as they would in the clinical setting. They can ask questions. The patient might complain about something. They may not understand an intervention or a complication that they're experiencing. So the students can work through that. But on more of a physical level, the students can insert IVs, they can do intubation with the respiratory therapy students. They can go through all of those maneuvers. They can learn how to use the defibrillator, like that's on the crash cart behind you, because it's a safety thing. So here we're in a safe environment where they can go through all of those steps. They can pause the scenario and talk about it if they need to, so that they can really take in all that information in a safe way.
So you can address some issues during the simulation.
Sure.
I guess that's an instructor's decision to do that. Or you definitely, at the end, we do what's called debriefing. So tell us about that debriefing process.
Absolutely. So the debriefing follows the simulation experience right after, right when everything's fresh in the students' minds. It involves all the students that were in the scenario as well as the faculty, because the faculty is the content expert here. And it's a chance for the students to really recap what happened in the scenario. A lot of the literature says that's where a lot of the learning happens, because the students are able to really reflect on what happened during that scenario, talk about all the things that really went well, talk about all the things that maybe didn't go so well or as they would have planned, and then talk about why. So if they made a mistake, why did they make a mistake? What were they thinking when they made that mistake, so that they can retrain their minds to kind of decision make in a different way.
I know it's still in a safe setting and not quite like the real thing, but it's the next best thing, I think, to the real thing. So that's what makes it so valuable. I know the other thing that's helpful is in all the rooms there's cameras, right? So students, I'm sure they're not that comfortable with that, but that's a good part of the learning is they can always watch themselves in a certain situation.
Right. So we do have cameras in every room, we have microphones in every room, and we do video and audio record the experiences that happen in the simulation center. The reason for that is so that the students can go back and watch themselves in the video. And pick up on things that they may not have realized that they did. And that could be as simple as body language or how they were talking to the patient. Or it might be maybe they're working with a team, and so they wanted to kind of focus on what the other teammates were doing and give some feedback to those teammates as well.
Well, I think that's a great place where learning takes place. Sometimes they're available for students to view online, so they can go home later that day, kind of take a deep breath and then watch themselves in private to get a feel of, what was I good at, what could I improve upon. I think that's a huge part of the learning.
Absolutely.
So how about we take a look around?
That sounds great.
So Catherine, here we are with a patient that we use a simulator for adult health, and introduce us, please.
Sure. So this is our adult high fidelity patient simulator. His name is iStan. He, like I said, is one of our adult males here at the simulation center, so our students can come here to practice giving patient care here with the adult patient. A lot of patients there.
And of course, you use scenarios here with different types of complaints or
Yes.
conditions. And I see Stan's breathing.
He is.
And
Yep.
how are you maneuvering
So
all
if
this?
you look closely, his chest is rising, his eyes are blinking. Stan is awake and healthy right now. This tablet here that's in front of me, this laptop, this is what controls the physiology. So I'm in control over what the students would be seeing and how iStan is displaying his condition. So I could click and I could change different parameters here so that the students could then respond.
So you can change his respiratory rate, his heart
Absolutely.
rate, and then that's reflected up there on
Absolutely.
what the students see.
Yep.
And obviously you're in a different part of the room
That's
doing
right.
all this.
That's right. That's
so
right.
they can't see what's going on.
Yes, the students are in the room. Traditionally, they're in the room without the faculty member and without a simulation staff employee, so that they're taking advantage of the resources that they have. So that might be a textbook, or that might be a peer, that might be using the phone system here to make a phone call to talk to someone else in the hospital setting, or it might be the monitor. So using whatever other resources that they have. We're not in the room there.
Now I know we have a crash cart nearby, which
there.
isn't typically the case where it's right next door to the patient. But tell us about the other equipment in the room that
Sure.
makes it look like a real hospital room.
Okay, so the room is designed to look like a real hospital room, and it functions like it would in the real hospital setting. So the suction there is real. Students can turn that on, they can use it. The oxygen is all real oxygen, medical air coming out of there, all real IV pumps, and we have that all real and functioning so that the students can have that experience. We want them to have the opportunity to actually use the equipment that they're going to be using out in the clinical setting, not just pretending to do it. So we integrate all of that into this scenario.
Very good. And of course, instructors can be watching through the cameras.
Yes, yes.
And then of course, some of them, I guess, not all of them are graded, but some are. They're a graded experience?
Sometimes, it depends on the objective of the scenario. Most of the simulations that happen here in our simulation center give formative evaluations. So it's that debriefing discussion that happens after to give feedback from the faculty to the student, and
So
gives
more
it a
about
chance for
learning
the students
versus grading.
to get a better understanding of what's happening. But simulation can be used as summatively with evaluations. We do a little bit of that here. Sometimes we'll do courses that'll end in a certification, so things like American Heart Association, Advanced Cardiovascular Life Support, Pediatric Advanced Life Support, all of those end in certifications, so they are a summative evaluation. And the faculty will use those cameras to help evaluate the students.
Sure, and it's nice because it's unobtrusive. I mean,
That's
you're in
right.
here just focusing on the patient and what
Right.
needs to be done.
Right.
So it is just a wonderful learning opportunity.
Absolutely.
Now let's take a look at some other rooms we have available. I think
Okay.
labor and delivery next.
Labor delivery next.
All right, let's take a walk to there. Well, Catherine, before we go to labor and delivery suite, let's check out this area, which is meant to look like a real nurse's station,
That's
complete
right.
with the chart rack, the phone, the crash cart nearby, the linen cart.
Yeah, so this is a pretty busy area on a busy day in the simulation center. A lot of times students will get a handoff report here or give a handoff report to the next student here. And then behind us is our simulation workroom. So that's where all of our inventory is with all of our supplies and our extra equipment.
Plus, students can pretend, you use that as a supply room. If students are doing a sim and they need certain equipment, then we send them to the supply room,
Right.
which in real life can be
That can happen.
overwhelming initially because
That
there's
can
so many
happen.
different medical supplies to choose from. Let's take a look.
Sure.
So here we are in the supply area.
Yeah, so all of the supplies that are here are again real, just like everything else in the simulation center. A majority of the scenarios will have the supplies in the room for the students, but there's always an opportunity to incorporate that because that could be a good scenario for the students, is learning how to find what they need, only take what they need.
Exactly.
And then learning how the inventory system could work.
So it looks like the only thing you're missing is the hospital charging system.
Yes,
to help
charge
students
that patient.
learn the importance of when you take a supply, you have to charge for it. Let's stroll over to labor and delivery.
Okay.
So here we are in the labor and delivery suite. So tell us about this high fidelity mannequin.
Sure. So this is Lucina. She is our birthing simulator. So being on the Eastern Shore of Maine, or really anywhere, births are unpredictable. So having a birthing simulator gives us the ability to ensure that all of our nursing students can see a birth and see a delivery and participate in that care. The other thing that's unique with her is that they're not only going to see one section of the birth, but they can talk to her and help plan for the birth. They can then do a newborn assessment with the newborn. They can do a postpartum assessment, so they can really see the patient through her entire care.
And there is a baby in here?
There's a baby in there.
That when you turn her on, she will actually deliver the baby?
Yes. And so just like on iStand's tablet, she has a laptop as well, that we're controlling the physiology of the mom, but also the physiology of the baby inside. And then we can program it to be a healthy birth, or maybe for some complications to happen and for things to go wrong.
Yeah, we know unfortunately things can go wrong, and
Right.
students probably wouldn't see that in the hospital.
Right. And it's a good place for them to experience that here. It's in a safe environment. Again, we talked about them being able to kind of pause the scenario and talk things through if they need to kind of slow that scenario down. So that can happen all of here, so it all happens in a safe way.
And then I see you have a area over there where the newborn goes.
We do, yes. So the newborn that she births is not high fidelity, so it's not quite as realistic. It looks realistic, but doesn't do so much. So we do transition to a high fidelity newborn over in that.
Well, let's take a look at that.
Okay. So this is our newborn patient simulator. His name is Hal. He can be female or male. We can swap that out. He weighs the same as a newborn would weigh. He's all wireless. Let me unwrap him here so you can see him. But again, being high fidelity, that just means that he does what you and I would do, or what a normal newborn would do. So he has pulses, he can cry, he can grunt, you can intubate. All the things that you would want to do in a resuscitation or a newborn assessment, you can do with Hal here.
And you're saying you can switch out down here if you want it to be a girl or a boy? Oh, wow. It's amazing what you can do with technology.
That's
and of
right.
course this looks
Yep, it's a working,
Yep.
functioning warmer here. So the students, that's all part of it, is using the equipment, learning how to use the equipment and using it correctly.
Well, I imagine that would be very helpful, because one of the most intimidating things to me about going into the hospital for the first time as a student is all the equipment.
Of course,
starting
yeah.
with the bed, you
Yeah.
know, how to get the bed up and down, the head up, the head down,
Yeah.
and then all this other technology and equipment. So
Yeah, they get that experience here, absolutely.
So where are we off to next?
We're going to head to the neonatal intensive care unit.
Okay, let's go.
Okay, so now we're in the neonatal intensive care unit. We have another newborn mannequin, also named Hal, Hal's twin. So the students can have another experience in here. The experiences that do happen in this room are usually a little bit different because we are in the neonatal intensive care unit. A lot of the courses and the students that use this room are respiratory therapy, and they're doing resuscitation programs. One thing that our respiratory therapy students graduate with is a credential, a certification in neonatal resuscitation program. So they practice all of their scenarios in here, again with the working warmer, the working head wall, and all the equipment that they would have in that
so
resuscitation.
you have a resuscitator.
That's right, yeah,
and you have an incubator over here. Well, I think it's a great opportunity for nursing students in particular, and respiratory, because we know at the local hospital there's limited opportunities for neonatal ICU care. So this would be a wonderful experience for both nursing and respiratory therapy.
Right. Things that they may not be able to experience out in the clinical setting.
So where to next?
We are going to head to the pediatric room.
Okay.
To peds.
So Catherine, what's this little girl's name?
So this is Molly. She is our pediatric simulator. Again, high fidelity, just like our other mannequins here. So the things that she can do is going to mimic what a pediatric patient would do out in the hospital. She also is wireless, so she's controlled from a tablet that we would take out of the room. The students would be in here in their simulation.
I see you have the same situation where they will have the vital signs on display up there, and all the same equipment you have in the hospital, including this more elaborate pump system. Tell us about that.
So we have the IV pump, and then we also have a syringe pump. So being a pediatric patient, making sure that they're getting the right dosing, the right, of course, medications and things like that. Having the pediatric simulator is really beneficial to our students because being on the Eastern Shore, we don't see a lot of pediatric patients in the hospital. So our students may not get to experience some things before they graduate. But here we can kind of dial that up and let them have that experience.
Well, we know they're trying to keep kids out of the hospital these
That's right.
days and manage them at home, so the pediatric units just aren't quite as busy sometimes.
Right.
So this is a great opportunity.
Yes, yes.
So what kind of sims are you doing in here?
So we vary with the sims, but again, it's a lot of things that we would want them to experience here for the first time, either for a safety reason or things that they're going to see all the time. So something like asthma, where we want them to really refine that skill before they're out and working in the workforce.
So a lot of respiratory assessment.
Respiratory, yeah. Medications and dosing calculations, all those kinds of things are going to happen in here.
And any other ones that you do more commonly besides asthma?
Well, we have a diabetic ketoacidosis patient come in, things like that, so that the students can pick up on all of those cases.
That's terrific. I know the other thing you wanted to show us is the AccuDose system, which simulates dispensing medications.
Yes.
Let's take a look.
Okay. So we do have some simulated technology here in the Sim Center. This here, like you mentioned, is a simulated AccuDose. So part of what they're doing is getting experience getting the medications that they would need for their patient. It is interactive, so the students are clicking through, they're selecting their patient, they're selecting the medications, and then it'll tell them how to get that medication so that they can ensure that it's appropriate for the patient.
So they get some real life experience on how to operate this kind of equipment.
Yes,
absolutely. Because this can be very, very scary for students just to learn how to use the medication system.
Right, yeah, and it's really important for them to know, make sure they're getting the right medication for the right patient.
I know one last thing you wanted to show us is you actually have a simulated electronic health record.
Yes, let's go take a look at it.
Okay.
So we have created a simulated electronic health record for our students to use during the scenarios. Just like the AccuDose, it's interactive, so the students can come here, they can get a summary of the patient, they can look at any results that may have been incorporated into the scenario, they can document live on the flow sheet. They would be able to read any progress notes, look at the orders, document the medications that they may have delivered or administered during that scenario.
So that information is all preloaded and can be modified accordingly as well.
It is, yes. Yeah. And that's one of the benefits of creating our own here, is that it's completely customizable. It can be used for all sorts of different disciplines. It's not specific to nursing, and it's a very low cost.
It's just wonderful. The whole place is just so impressive. I really thank you for giving us a tour.
Absolutely.
I know you wanted to mention that it is available to outside organizations and such for a fee, of course, but to use it. So tell us a little more about that.
If anyone has more questions or wants to know more information, they can visit our website. If you're interested in a tour, they could contact us at the Simulation Center and we can deliver a tour for them. We've given tours for many different community groups. Girls Innovation Academy, we've done the Girl Scouts of the Chesapeake Bay. We do the Worcester Technical High School. Their students come here for a tour pretty regularly. We can do that. And if they're interested, someone's interested in a scenario, we can also do that. Okay. So we could talk to them and kind of help with their education needs as well.
And of course the tours are free. But
yes, the tours are free.
If someone wants to use the facility for training purposes, then there is a fee involved and they can contact you about that as well.
Yeah, absolutely. They can contact us and we can start a discussion on that.
Well, that's terrific, Catherine. Thank you so much for showing us around. What a wonderful resource for the community and to help train our future healthcare professionals.
Yes, thank you for having me.
And thank you for joining us for this edition of Focus on Health here on PAC 14.